So today we'll learn about some basics first aid management. Okay. First, I'll start with the first aid symbol. First aid symbol is uh, white cross and red background. White cross here defined as need for help, and red it implies urgency or emergency of the needing help. Okay, understood? So at the end of session, we'll learn about basics first aid principles. We'll learn how to practice K emergency responses. Then we'll gain some hands-on experience, and we'll build some confidence how to manage emergencies. Okay. So I'll start with definition of first aid. What is first aid? Can anyone tell me in a simple word? Basically, first aid is any sort of help immediately after injury. Okay. Injury basically it can be illness also, injuries or illness. It is basically a breach between the that injury site scene and the hospital. Okay, it is middle breach between the that injury part and patient to reach before hospital. Okay, so there are three objectives of first aid. These three objectives are 3P. First P is to preserve the life. Second P is prevent further worsening of the conditions. Okay, and third P is promote early recovery. Okay, so there is 3P. Next is what are the golden rules of first aid? First of all, we have to ensure the safety. First and almost first thing is safety of yourself. Your safety comes first. Okay. Then you have to stay calm and you have to act quickly also. Then we have to reassure the casualty, what type of casualty you have to identify. You have to reassure yourself. You have to reassure the bystander and the patients also. And you should not move the casualty unnecessary. Okay, like you should not move the patient unnecessary. First, you have to make them to a safety place. Then you should not move to unnecessary. Further unnecessary movement it can cause further harm. Okay. And last thing is to get early professional help. Professional help meaning to get help from doctor or nurse or any healthcare person who is already trained. Okay. What is primary survey? Like any person who collapse suddenly, then what is we do is called primary survey. In primary survey, I think you have already attended a class on CPR, and in that you have learned about ABC. A for airway, B for breathing, C for circulation. Okay. That ABC itself is a primary survey. Okay. So when we will be doing a primary survey, suppose any patient who collapse or any sort of injury will do this primary survey. First is to ensure the safety, to ensure the environment safety, scene safety. Okay. Then you have to check the responsiveness. If somebody collapses or any injury, like any sort of anything, first you have to get the patient response, whether patient is conscious or unconscious. So second thing is consciousness, responsiveness, and then we'll go for ABC, A for airway, B for breathing, and C for circulation. This will remain for your rest of the life. I mean, A for apple, B for ball, and C for cat. What we are learning from childhood, Now it is A for airway, B for breathing, and C for circulation. Okay. Secondary survey. Secondary survey will do when patient is responsive only, or if we ABC in ABC, if airway is absent, airway breathing circulation is absent, then we'll definitely start immediately CPR. Otherwise, if everything is okay, then we'll go secondary survey. The primary survey itself is okay, then we'll go for secondary survey. Secondary survey will be like we'll examine the patient from head to toe, like any sort of injury. We may take blood pressure, pulse rate, respiratory rate, temperature, then any signs, any allergies, any medication history, and anything else, any medical history. Okay. Any examination, clinical examination, that all will come in secondary survey. Primary survey is always like ABC. So CPR, I think you people already know about CPR. You had a class on CPR. I'll just go briefly. What are the important thing in CPR? The main thing in CPR is you have to push hard and fast, and the rate should be, pumping rate should be 100 to 120 per minute, and this should be enough depth. Usually it says 2 inches, 5 to 6 centimeter, and there should be after every 30 compression you should give 2 breath. Okay, and you have to continue until help arrives. Basically, CPR means if sudden cardiac arrest, meaning your heart is stopped, heart stop working. So remember one thing, that if patient is cardiac arrest, if heart stop, patient's heart is on your hand. Just remember like that, that patient heart is on your hand. Unless and until you do CPR, heart, there will be no circulation. Okay. This is just a pictorial representation how you will go for CPR. Compression. Next, what is this? This picture. I think this is just bleeding from an injury usually called as abrasion. There are various types of injuries. Gradually we will be learning further. I mean, like there are different types, cut injuries, there are chop injuries. Various types of injuries are there, stab injuries. You will learn gradually. So this is just a representation of bleeding. So our next step is first aid for bleeding. It is just basic, everybody know this. Bleeding, if any site is bleeding, first step is always to give direct pressure to control bleeding. Okay. Then second step is to just elevate. Suppose it is injury to the leg, you have to elevate the leg region. Why will we elevate the leg or hands? Any part bleeding, first step is to give the pressure, second step to elevate the limb or hand, whatever. Yes, exactly. Basically, it is just a gravitation effect to reduce the pressure. Okay, just a gravity effect. Third step is if further bleeding is not stopped, then we can give a pressure bandage, and do not use soakable. After an immediate injury in a bleeding case, do not use any soakable bandage. It will further soak the blood. Okay. And last and foremost thing is we'll use tourniquet. It is a last resort basically. Tourniquet will apply when bleeding is not controlled by giving pressure, elevating the legs, using pressure bandage. Okay, it is a last step. Tourniquet means basically to apply any, you can use any thread, any rope, or anything, just to use a tourniquet to just to prevent further bleeding. Okay, it is last resort. Always it is last resort. Next, what is this? It is a burn injury. So next we'll know about first aid for burns. First step in burn is to ensure the septicin, basically, that primary survey we know already. You have to prevent further damage, further burn. You have to ensure the septicin. You have to remove the patient, remove the victims from the area, from the accident area to a safe area, basically the septicin. After that, in management part, first we'll do is to apply, to cool down the burn, okay, to get immediate relief. In cooling down, we'll be always using running water. Running water, basically not the cold water. The water temperature should be always more than 15 degrees. It should not be ice. It should not be any freezing substance. Okay. Why so? Why we'll be using only running water or tap water, or like it says it should be more than 15 degree temperature. It should not be cold water. It should not be ice. It is only recommended is only running water. It has a logic, no? Everything has a logic. We'll be using only running water, tap water, or any water or any substance which are more than 15 degree, because cold substance, ice or cold water can cause constrictions. Your skin will be constricted. Skin will be constricted. What basically any cold substance what do to the tissue is it constricted the tissue, it constricts the skin surface, even gaps, it reduces the gaps between the tissue. So it causes vasoconstriction, basically. It constricts, basically. So if there is constriction, there will be decreased microcirculation. In cellular level, there will be less circulation. Constriction is there will be less circulation. If there is less circulation, there will be less oxygen, there will be hypoxia, and it may cause tissue damage, okay, or cell death. So we'll be not using ice or cold water. And further, cold water may precipitate pain because of vasoconstriction. It may cause further pain. In burn, in superficial burn, there is already severe pain, severe intense pain. If you apply cold water or ice, there will be further pain because of vasoconstriction. So we should not use any cold water or ice. It should be always 15 degrees centigrade. Next step is to cover the wound, burn wound with a clean cloth or sterile dressing to prevent any infection, to prevent any dust to fall in. Okay. Then third step is do not apply unnecessary anything. Like do not apply toothpaste, do not apply any oil, butter, anything. Why will we not using toothpaste? Any reason? That is one of the reason, but not the first reason. Because toothpaste itself is a alkali, no? Acid, alkali. Toothpaste is a alkali. Toothpaste, soap. These are all alkali. So if you apply toothpaste, it is alkali. It will cause alkali burns. Okay. And oil and butter will not apply because what you said before treatment, it may affect the treatment. This is the reason. And another thing is, if you apply oil, like direct aeration of the tissue, direct aeration will be also hampered. And fourth thing is, do not, if there is blister, after burn there may be blisters also, do not brush the blisters. Because if you brush the blister, the layer in the blisters act as a dressing, superficial dressing. It will prevent any infection from outside. So will not blister. We can blister in hospital setting, in a sterile setting, but usually you should not brush the blister. And finally, you have to get the early medical help. Okay. These are the just pictorial representation. If on fire, first you have to ensure the safety scene. Then you have to damage further. You have to reduce the further burning. You have to remove the affected part, clothing, any jewelry, any metals. Then you have to cool down the part. You have to give the immediate relief by giving running water. Then you have to cover the injury to prevent any contamination. Then you have to get a proper provision and you have to seek urgent medical help. Next is about first aid for electrical shock. I think everybody knows this. What is the first aid for electrical shock? After electrical shock, if anyone is getting electrical shock continuously, first step is always to cut down the electricity. Before that, you have to see your safety also. You should not be the victim. So you will be always using like dry wooden stick or something, anything. Or you may directly cut down the power supply, anything. So first step is do not touch. You have to cut down that conduction. Okay. You have to unplug the appliances. Then if patient, it is the first step. If patient is already unconscious, what electrical shock will do is basically it may also cause cardiac arrest. It may cause any sort of cardiac arrhythmia. Basically electricity, no? So electricity can hamper with the cardiac electrical activities. So there can be cardiac arrest. There can be any cardiac arrhythmia followed by cardiac arrest. So if patient is unconscious, then we'll do our primary survey, AVC. If patient is pulse is absent, circulation absent, breathing absent, airway, then you have to immediately start CPR. Okay. Then next thing is you have to you should not remove any clothing or anything. You may cover the patient with a blanket or anything to prevent hypothermia. Okay. Then there may be burn injury also after electrical injury. Then you have to treat them as a burn injury also. You have to treat as a burn injury also. Remember, even if after electrical shock, after electrical burn, even a small injury may look small, but it can be very dangerous for life also. Okay. So even for electrical injury, even a small burn can be very dangerous. So do not just ignore the small injury after electrical burn. Next, what is this? It is the X-ray of forearm showing fracture. Okay. So next we'll learn about first aid in a fracture. So first step in a fracture is you have to immobilize. Suppose it was a fracture in forearm, you should not immobilize. You should not mobilize. You should not move. Should be immobile. For immobiling, we can use any stick, any cardboard should be in a straight line so that it should not move. Okay. Then if part of bone is disaligned, okay, any dislocation, you should not try to realign it because it may damage the artery, damage the brain, damage the tissue also. Should be done in a hospital setting. In a accidental scene, you should not try to realign the part of bone. And you can apply any cold pack, cold ice pack to reduce the swelling. If any bleeding, you should apply the bleeding first aid. You can apply pressure. You can apply bleeding is uncontrolled. Last resort is to use a tourniquet. You can use pressure bandage. Okay. So and then after that, after giving primary aid, you should transfer immediately to get professional aid. Okay. This is just what you will be doing, like immobilize, just applying a cardboard so that it should not move. Then what will be not doing is you should not realign. You should not tie too tight. After attaching the cardboard or stick, you should not tie too tightly. Okay, because if you tie too tightly, it will act as a tourniquet. It will reduce circulation. It will cause hypoxia. It may even damage the tissue. Necrosis. What is hypoxia? Types of hypoxia. Next is first aid for choking. Any idea what is choking? Choking is like anything with obstruct the upper airway. Okay. Patient will be air hunger. And this sign is called as universal sign of choking. So in choking, we do the Heimlich maneuver. I think you people already know that. If anyone is choking in front of you, first step is always choking can be mild, moderate, severe also. It can be a direct obstruction, complete obstruction, that will be severe, or a partial obstruction, or any foreign body substance to the trachea, to the airway. It may cause a partial obstruction also. In partial obstruction, the patient is coughing by himself or herself. You should always encourage to cough out. Even after coughing out, if patient is able to coughing is always first step. If patient is not able to cough, then we'll go for Heimlich maneuver. I think everybody know about Heimlich maneuver. And one thing, there is another question. Foreign body disclosed to right side, usually disclosed to the right side of lungs. I think that was your university question. Final anatomy. Maybe in second paper it was a university question. Foreign body disclosed to right bronchus. Can anyone say the reasons why foreign body disclosed to the usually right side of bronchus? This is just one reason. There are three reasons. You have to, for full mark, you have to write all three reasons. So these three reasons are: first is what you said, that right bronchus is a little less angulated. It is more vertical. That's one reason. Second reason is it is wider compared to right. It is more wider. And third reason is it is shorter. Anything which is a shorter part, we'll go for that shorter part. Na? Even if there is two road, we'll select the shorter pathway always. So three reasons are more vertical, more wider, and shorter. How to perform it is just a pictorial representation. You will be in the back of a patient and you will be give the abdominal thrust or pressure. Next step, there is a video also. साउंड আসে না সাউন্ড নেই
Says when you see someone choking, it's important to remain calm and let them know you're about to talk. So you want to listen.
so patient was choking
Person's out, and then follow, and then sharply apply pressure. So it's all the time with you. One single great problem says to repeat the process until you see the object you're choking over come out of the person's mouth. 1, 2, 3. Are you okay? Yeah, thank you so much. Yeah, you're welcome. Glad I feel better. The person loses consciousness before the object comes out. Make sure someone calls 911 for help while you continue to look to clear the person's air or soon to make them lose help. Thank you, Mom.
so that was Hamlet's maneuver I think already you all know about Hamlet's maneuver okay you will be practicing this one. So next is syncope. What is syncope? Anyone? Syncope and fainting both are similar term only. I ask what do you understand by syncope? Anything in your own word. I'm not asking a definition like machine. Dizziness is like chakkar. Dizziness, giddiness, it is a chakkar only. Like giddiness, dizziness, blurring of vision like andhara chhajana, these are syncope sign. After that there will be syncope. Syncope is basically transient loss of consciousness, like patient will be unconscious suddenly transiently and the patient will gain consciousness immediately also. It may be less than 1 minute, it may be even for a second. For that few seconds unconsciousness, patient will be like patient will get the syncope. There will patient will fall down, patient will collapse. So chakkar, giddiness, dizziness, any blurring of vision, sweating, severe sweating, these are, I think you already gone through this. Somebody collapses, somebody syncopes. So okay, so first step in syncope is to lie down the patient in a supine position. After that you have to raise the leg of the patient. There are several causes. I think there are more than 100 causes of syncope. Basically anything can cause any medical or anything, but most common cause is vasovagal syncope. Vasovagal meaning is you are standing for a long time, then there will be pulling down of the blood to the lower limb, lower part of the body, and there will be less blood circulation to the brain. That is the most common cause. So more than 50% of syncope are vasovagal syncope only. So first you have to lie down the patient in a supine, then you have to raise the lower limb, raise the legs, so that the blood, that same gravitation, blood will be pulled down to the lower part and there will be more circulation to the brain and patient will patient will get the relieved or get consciousness back. Okay. So after that you have to ensure patient you have to loosen the clothings, like sometimes clothings like belts. These also act as a circulation, tourniquet, no? It will prevent circulation. And you have to ensure airway. Then you have to check the B and C, breathing and circulation. Next is first aid for a seizure. Anyone know what is seizure? Anyone from this part? What is seizure? Seizure, convulsion, anything? Okay. Seizure is like any involuntary contraction, involuntary movements of the hand, basically due to altered electrical activity in the brain. Okay, there are various types of seizure. There most common type which we can identify easily is like tonic-clonic, generalized tonic-clonic, like there will be severe involuntary movement of the hands and legs. So first step for seizure, like seizure can occur anywhere, any place. First step is like you have to ensure the safety scene. You have to prevent any injury to you and patient also. So you have to move patient to a safe place. Okay. Next step is to make the patient's head and neck stable, so that there should not be any during convulsion. There should not be any injury to the head or neck part, basically. Then we have to turn to patient to one side. We have to turn the patient to one side. What happened during seizure? Patient tongue is also a muscle. There will be involuntary contraction in tongue also. Tongue has a property to fall back. Like tongue will obstruct the airway. So that's one thing. And second thing is there will be excessive salivation, excessive secretion. If you do not turn to the patient to one side, there will be aspiration to that right bronchus again. Aspiration, there will be chance to the tongue fall back and prevent airway. Okay. So basically to prevent this, you have to turn patient to a side. First is to stable the patient head and neck. Then you have to turn patient to a lateral side, basically lateral position. Okay, then you have to wait until the seizure ends. Or if seizure not end, you have to get immediate help. You have to transfer immediately patient to the hospital. This is just chronic.
It's caused by a disturbance in the brain's small electrical activity. First aid procedures is simple. Protect from injury, especially to the head. Remove glasses or other potentially harmful objects. Turn on one side to prevent choking. Check for lead body. Don't put anything in the mouth. And don't hold down, because restraint could cause swelling and muscle injury.
The likelihood that someone who died during seizure is very small, and although the person who looks that they're going to die, that is that they oftentimes will become somewhat blue, there may be some changes in the breathing pattern. These are all part of the seizure itself, and they are all very temporary parts of the seizure.
Seizures usually end spontaneously after a minute or two, but afterwards, the person may be sleepy, agitated, or confused. A seizure can occur at any age, from the very old to the very young. An ambulance should be called for a first-time seizure when someone is injured, pregnant, has diabetes, or when seizures are prolonged or occur abundantly.
It's very important to time the seizure, and if the seizure lasts more than 5 minutes, that's usually concerned and we call the ambulance.
The most important thing that we can do for someone having a seizure is to stay calm, to be with them and to be reassured.
And when it's over, just, act like everything's okay. Be reassured. Because it isn't any fun to have a seizure. And when the seizure is over, you need to know that you still have your friends and they accept you.
Next is snake bite. First aid for a snake bite patient. Snake bite, there is a 2 bite mark. These are called as fang mark. Usually snake bite, 90-95% of snakes are usually non-poisonous only. Only 5 to 10% snakes are poisonous in India. Okay, this is how a snake bite look like. There will be usually 2 fang mark. Even 1 fang mark is also there, but usually 90% of time it is like 2 bite mark will be there. And there can be one bite mark also. Even there can be some snakes are so notorious, like some crates. There, even there will be no bite mark also. Even without bite mark, possibilities are there that already snake bite is there. Okay, but usually it is how to identify snake bite is. There will be two bite mark. These are called as snake mark. Okay. So what are the first aid for a snake bite patient? There are do's and what are the don'ts. Will be first go for what we'll be doing. First thing is to reassure the patient, because 95% snakes are non-poisonous only. You have to ensure that this is non-poisonous. Patient otherwise maximum time they are very anxious. Like even after a bite there will be very anxiousness. After if very much anxiety, there will be release of catecholamines, release of noradrenaline. That itself may cause any like will further damage the cardiovascular part. Okay. Next thing is to just immobilize the limb bitten or the part bitten, just like what we did in a case of fracture. You have to immobilize, like it is a upper limb or a lower limb or any part. Make sure that it should not mobile, because if there is movement, increased movement, it will increase the chances to early toxicity to occur. Okay, so immobilization of the limb is the first thing. Second thing is keep the patient as rest position, at supine position or in sitting position. Patient should not move. Then you have to transport the patient immediately. And you have to remove any constricting any items like tight clothing, any ring, any ornaments, any bangles or any show which can constrict, which can prevent circulation. Then if there is any, you can apply immobilizing bandage also. Like you can use a stick, you can apply immobilizing bandage also to just prevent immobilization. What we'll not do is first and foremost thing is, main thing is you should not apply any tourniquet. Like in localities there is a thing that usually they apply tourniquet thinking like that that poison will not travel to the other part of the body. This is common practice, very common. You will find that if it is snake bite in the leg, patient will apply just above the bitten side, thinking like that poison will not travel to the other part of the body. But applying tourniquet, basically you are harming more. How? Can anyone say how it can harm further? Because poison are toxins, poisons, that they are toxins. After applying tourniquet, first thing is there will be local toxicity. Locally, there will be toxicity. It may damage the limb early. Like there will be high concentration of toxin and poisons in the legs, suppose in the legs. So that will cause local damage. One thing, there will be increased chances that tissue damage, and further, even if patient alive, you may sometime need to amputate the limbs. Like it will be, toxin will destroy everything. It will cause necrosis, it will cause gangrene. So you should not apply tourniquet. One thing is that. Second thing is that it will prevent circulation. So there will be that ischemia hypoxia part is there. Second thing is there. Then third thing is after getting a patient to the hospital, we'll remove the tourniquet. During tourniquet, there will be a sudden gush of the poison to the other part of the body. So sudden gush of toxin as a higher level, it may damage, it may impact hugely to any brain or any, cardiac muscle or anything. Systemically, it will damage more. So these three reasons, we should not use any tourniquet in a snake bite patient. This is very commonly done and commonly practiced in locality. Next is we should not cut, we should not suck, we should not insect the bite site. I think these are all seen from movies only. You may have seen, or in any wild, Mercer wild, there are provisions like they will cut the bitten part, thinking that poison will go like that. Should not do that. There will be no ice pack, no chemicals, no herbal remedies or alcohol. There should not be any unnecessary washing. These are the first steps. And what you will be doing in hospital setting, this will learn gradually in your next upcoming days. Okay. So these are don'ts and do's in pictorial representation. Next is the first aid for animal bites. Animal bites, more common here is dog bite. Can anyone say what dog bite can cause? Which disease? Any idea what rabies is? What is rabies basically? Rabies is a viral disease. It is 100% mortality. If once rabies is diagnosed, no medication, I think hardly 100%, there is 100% mortality once rabies is diagnosed. So animal bite, first thing is that dog bite, and there can be any other animal bite, any wild animal, any domestic animal, anything. There are animals who needs rabies vaccine, who doesn't need rabies vaccine. We will learn this further in microbiology, in medicine. We will be learning this. So I will just teach the first aid. First aid for animal bite is to wash the bite area, soap water for 15 minutes. You have to wash the wounded part with soap 15 minutes, I repeat. 15 minutes is the ideal time. If you wash with all steps, there is a 90-95% chance that microorganism will be destroyed. So it has the maximum efficacy. Further, even if you give antibiotic, any vaccine, anything, any prophylaxis, maximum effect is with washing with soap. Then we can apply any antiseptic and do not cover too tightly, same provanda. Then you may seek for any rabies post exposure prophylaxis, then tetanus prophylaxis if required. Next is first aid for poisoning. Poisoning can be suicidal, poisoning can be accidental, poisoning can be homicidal also. So first step is you have to identify the poison, like container, smell, history you have to take. Ideally, you have to usually advise, or there should be provisions that people should know that people should carry the container. Which poison is that? So it is important to give the antidote, poison antidote. Okay. So what first aid in poisoning is, you have to identify the poison. Do not induce vomiting unless advised. Do not induce vomiting in a non-hospital setting, and you have to do all your primary survey AVC again, then this and early professional help. Then what is first aid kit? You have to make a first aid kit, no? Usually first aid kits are there in like in a class, in a hospital, in a ward, or in an airport, in a railway station, anywhere. There will be a first aid box. What is the thing there will be in first aid box? Like there will be sterile pad, bandage, adhesive tabs, antiseptic solution, gloves, scissor, thermometer, torch, safety pins, ORS, basics, all splint, then bandage. Okay. In sometime they keep. Usually you have to keep automated defibrillator also. Okay. Usually in developed country they keep automated defibrillator also. These are the first aid essentials. Next. So do's and don'ts of in first aid. Do's is like you have to stay calm, reassure the patient, call for professional help. You have to use protective gloves. And don'ts are: do not give food, drink, do not move the patient unnecessary, and do not ignore any small wound. Like I have explained, even a small wound can be very dangerous in a case of like electrical burn, so even small and smaller wound. Not even electrical, any other injury, even injury to the any neck part, any head part, small injury can be very dangerous. So these are the things you have to remember.